you all might have become an expert in dealing the thyroid disorders than me, because I'm just having a practical experience, but I didn't listen this much class till now. So I congratulate Dr. Jasul and the entire team for organizing such a big event and making the entire Ayurvedic community or the entire participants making aware of these thyroid disorders. So of course, we know that thyroid disorders are the most confusing disorder, the spectrum of disorders among Ayurvedic physicians. Actually, I started my practice in the year of 2004. At the time, when I begin my practice, when the thyroid cases happens to come to clinic, I was unaware about such spectrum of disease. Not only me, and when we even so many beginners had the same issues. So the not only treating the cases, and they felt means we felt confusion. So much of dilemma regarding that, even the diagnosis also. So naturally, when such patients comes, we will discuss with our seniors, and they also have. Then we came to know that they also have the same dilemma. Usually, how to diagnose the thyroid, how to treat the thyroid, how to interpret the thyroid function test, how to interpret the USG reports, and what are the other tests needed for this thyroid to diagnose the thyroid dysfunction, etc. Were in the entire dilemma. This condition was there before 15 to 16 years, but later, within a short span, that within 5 to 6 years, the entire community became aware of this thyroid disorders, especially in the diagnostic parts, etc. In that condition, the role of social media, especially the Facebook or the other WhatsApp, etc., were much appreciable, because of such a awareness created. It's nothing but it's because of the different treatment experiences from the experienced physicians. Later, so now I think almost everyone has got the at least minimum basic knowledge regarding this thyroid functions, thyroid dysfunctions, and thyroid diagnosis, and even thyroid treatments. So anyway, I'm not going to the diagnostic parts and other investigating parts, etc. much, and because it's I think it might have been already dealt. And in my area is simple. It's pharmacology and pharmacodynamics of thyroid medicines, the medicines which are used for thyroid, and the wide logical selection of RESA drugs in thyroid disorder. So let us come to the topic. So I think that yeah, there is some.
Sir, you can screen share using the app, okay, rather than the screen, direct screen.
Okay.
So you can switch off the screen and then enter again.
Okay. Means I have to leave the.
No. You have to.
Okay. Only. Okay. I can stop this sharing.
Yeah. And enter again.
Yeah.
And use app.
Okay.
In this screen. Use the presentation software.
What about now? Is it okay?
No, sir. Not moving.
Let me once again.
चंदन चंदन हाँ फिर का गाड़ी ले आऊँ गाड़ी सर्विस पे दिया जल्दी है ना दिया ना अरे वो कभी आ रहा हूँ
Okay. Yeah, it's visible now.
Yeah, now ready.
Okay. So, of course, you might are aware that the discovery of thyroid gland had happened in the year of 1656, and the chronological development of thyroid disorders is almost like this. In 1874, these are the milestones in the treatment of thyroid disorders. In 1874, the discovery of thyroid functions, and in 1926, the discovery of its structure, and 1950, the discovery of T3 had happened, and the last was that in the synthesis of levothyroxine as the supplement of the artificial supplement of uh, thyroid hormone. That happened in the year of 1960. Actually, there ends the role of modern medicine here, because as per their idea, once a hormone or any substance which has been reduced in the body, if they could invent, or if they could discover an artificial supplement for that purpose, and if that can substitute the entire functions of the same hormone, their role has been finished. And later, absolutely, there very few researches has been conducted in the field of thyroid disorders from 1960 till this year 2021. It's because of their role has been finished, and here begins the role of Ayurveda. This is what I believe. Actually, our target is double folded. This is what I believe. We have to control the deranged hormone, as well as we have to control we have to cure the comorbidities. So control the deranged hormones in the sense, we know these are the main factors that these are the main diseases which has been produced due to the thyroid dysfunction. That is, the primary one is hypothyroidism, and the second is hyper. Then the structural abnormalities like goiter, and otherwise for the thyroiditis, etc. And the last one is tumors. I think this part I can skip, already been finished. And in the physical examination also, inspection, etc. I think it's been finished. And regarding the RESA drugs, just we have to be conscious regarding few steps, because it's not possible. The first thing is, it's not possible to by heart, or it's not possible to remember all the ingredients of the RESA drugs, because the same name, there are different combinations are available. So, for example, if we take some in the case of Lakshmi Vilas Rasam, there are around 10 to 11 different combinations. If we take if we consider the matter of Mrutyunjay Rasam, there are around 6 to 7 different combinations. And out of this, and even this, there is one Agni Kumar Rasam, it's a very common drug which has been used especially in North India. Sorry, it has got around 51 different types. Out of this, some of them are devoid of mercury and even sulfur. So this much complications are there regarding the combinations of RESA drugs. So it's not possible to remember each and every combinations of the medicine. So, but still, it is quite essential to know some factors, right? Some steps to prescribe the RSA drugs effectively. So we'll just see which are they. We have to know the chief ingredient of each and every drugs what we use. The combinations may be different. Some of them are many of them are rasa and parada and gandhaka will be there, but they will be in the minimum dose. The main ingredient will be something like valsanadhi or tankana or any other gauri bashana or haridala, etc. There may be some drugs. And at the same time, we have to know which is the most toxic ingredient, and along with that, the adverse effect which is produced due to the toxicity. And then the next stage is the antidote of the main toxic ingredient. Also, we should be aware. Then bhavana dravyas, we have to definitely we have to be cautious regarding the bhavana dravyas, because almost all these rasa drugs, that mineral drugs, are considered as the Sthavara Visha only. So at the same time, the Bhavana will be most of the time any of the other herbal, what we say, the Vishas like the Tura or what we say, the Nagavali Swarasa or any other Upavisha drugs, etc. Even Gunja Swarasa is there. So we should know regarding the Bhavana Dravya of each and every drug and dose and Anupana. These are the primary steps that we should be aware before we should be kept in mind before starting prescribing any of the rest of them. Now we'll come to the topic. Hypothyroidism, actually, it can be as far as the RSA drugs are concerned. Hypothyroidism, for prescribing the RSA drugs effectively, I will just explain the classification which I prefer to follow. That is, one is the primary hypothyroidism, and the next one is transient hypothyroidism, and the third one is secondary hypothyroidism. How these our medicines can be used effectively, that will see. Out of this primary hypothyroidism, that includes the iatrogenic cause. It can be due to the iatrogenic cause like subtotal thyroidectomy or radiation, and especially the radiation for this breast CA is the main reason for the many of the iatrogenic thyroiditis or hypothyroidism. The drugs like lithium and many other drugs which have got drug-to-drug interaction with drug-to-body interactions with especially the thyroid gland. Then congenital thyroid abnormalities like absence of thyroid gland or dyshomogenesis, or it may be aberrant thyroid also. And then infiltrative disorders like amyloidosis. Amyloidosis is nothing but the deposition of excessively formed proteins. Some of the protein molecules are being deposited, especially over the thyroid gland, and that is called as thyroid amyloidosis. The same thing can be deposited if the same protein has been deposited under the skin, it is called as cutaneous amyloidosis. The same thing can be deposited in the liver, then it is called as hepatic amyloidosis. So this amyloidosis is a quite common cause for this, especially the primary hypothyroidism. And then finally, the iron deficiency. And when we come to the transient hypothyroidism, it is nothing but silent hypothyroidism. Like in the main one is postpartum thyroiditis. You might be aware of this postpartum thyroiditis. It's nothing. Actually, this postpartum thyroiditis. If we get a postpartum thyroiditis, it means that is what we say. I would consider it as a boon to any Ayurvedic physician, because this postpartum thyroiditis is nothing but a self-limiting one. So it may be due to some of the. It is defined as produced due to the hormonal imbalance at the time of pregnancy, or even at the time of conception, or even at the time of lactation. So because of the hair falls, etc., the symptom they exhibit is nothing but hair fall, severe hair fall, or excessive lethargy. The patient goes for a thyroid function test, and by self analysis. At the same time, the result comes as the highly increased TSH. And mostly we say that it is we may diagnose it as what we say a normal simple hypothyroidism, but it is nothing but if we have to consider this postpartum thyroiditis if the patient is under lactation state. If a postpartum thyroiditis case happens to come to you, means there is nothing to worry. You can just give some of the Pajana drugs, and even if you don't give any of the medicines, also within 2-3 weeks, or maybe it may take within 1 or 2 months, automatically that comes the hormone level comes to the normal. So don't worry regarding the postpartum thyroiditis case. And the another one is subacute thyroiditis. Then the third cause is withdrawal of some supraphysiological thyroxine treatment, individual with an intact thyroid. Then Graves' disease. These are the main reason for this transient hypothyroidism. And secondary hypothyroidism, we know that hypopituitarism, it may be isolated TSH deficiency or any of the hypothalamic diseases like tumor, any of the trauma, or even neurosurgery, or any of the other infiltrative disorders. And I think I don't need to go to the clinical features, etc. Especially this investigations, you will be aware of this, how to this much class, because this Mukesh sir or our Aziz sir, etc. might have explained very well. And so I am not going to the diagnosis of this hypothyroidism, but there are some tests which we need to concentrate in our RASA practice. So that I will explain this. Especially in case of RASA, when you have to give rasaushadhis, you may need to test some more. You may need to send for some more analysis. That is nothing but the simple TFT may not be sufficient. Even ATP also may not be sufficient. You have to check for serum iron, serum zinc, and serum copper. We know that the main elements which are influencing in the synthesis of thyroid hormone is nothing but one is iron, another is zinc, then copper, then iodine, and fifth one is selenium. So out of this, the most important elements are iron, zinc, copper, and this one iodine. So if your primary test for the primary treatment, if especially better not to don't send the patient initially itself for testing the serum iron, serum zinc, etc. because these tests are bit costly, and each test may cost around 1,000 to 1,500. So better not to send the patient for the serum iron, zinc, and copper in the initial stages. You can do the normal analysis in the beginning, and you can start the treatment with the normal protocol. And if that protocol doesn't give you a satisfactory result within a span of 2 or 3 months, you have to send the patient for analysis of serum iron, serum zinc, and serum copper. And that also better don't send these three hormones at the same time. Sorry, these three elements at the same time, because it causes unnecessary harm to the and unnecessary expense to the patient. So, which are the main elements which can be deficient in the body? That we can understand from the symptoms exhibited by the patient. If the serum zinc has been reduced, the main symptom exhibited by the patient will be severe hair fall and severe what we say muscular twitching, the other muscular pains, what we explain as this pindigodvetana, etc. And if the serum iron has been reduced in the body, the main symptom exhibited by the patient will be severe lethargy. And serum copper, it's very difficult to find out the exact reason. So initially, depends upon the symptom exhibited by the patient. If the patient exhibits the severe lethargy or giddiness, etc., you send the patient for serum analysis of serum iron. And if the patient comes to you with the severe complaints of hair fall or brittle hairs, etc., you may, or severe what we say cirrhosis of the skin, the excessive dry skin, etc., if the patient exhibits, then you send them for the analysis of serum zinc. These three are the main tests that we have to be specific in the prescription of, in the treatment of thyroid with the RASA drugs. So, for easy convenience, the hypothyroidism I have divided into three. That is, one is subclinical hypothyroidism, and the second one is hypothyroidism with the thyroxine replacement, and the third one with the hypothyroidism with the thyroxine. The second one is without replacement, and the third one is hypothyroidism with the thyroxine replacement. The subclinical hypothyroidism, in the case, most probably, we will be diagnosing such cases. The first physician who happened to diagnose the subclinical hypothyroidism probably probably we. And the second one will be most probably with some other persons. And usually the patient comes to us is they will be diagnosing this the TSH, increased the TSH by around 10 or 12 or 15 by any allopathic, any modern medicine physician. And they ask the patient to start the thyroxine replacement, especially this levothyroxine. And at the same time, the patient asks the physician, that's how long we have to take this medicine. Definitely the next answer will be to the patient will be that you have to continue for lifelong. So at the time, patient get rethinking. Patient do the rethinking about this Ayurveda, and patient come to us with the same report. And in the stage, the thyroid TSH levels will be much higher, but the patient will not be. He might not have started the thyroxine replacement. That is the second type of case which come to us. And the third case will be the chronic hypothyroidism. They might have started the patient will be suffering this hypothyroidism since maybe 5 years or 10 years. And at the same time, he might have started the levothyroxine or thyroid replacement, thyroid hormone replacement also. Maybe even after 2-3 years or 4 years, they feel that they don't have much change in the symptoms, especially the hot flushes or the hair fall or lethargy, or only the symptoms exhibited by the patient will not be much. Will not be reduced much, and then they think that to shift to Ayurvedic medicine. So such groups are the third one. So the line of approach in all the three conditions are different. This is why I categorized the hypothyroidism into three. That is, one is subclinical hypothyroidism, and the second one is hypothyroidism without thyroxine replacement, and the third one is hypothyroidism with the thyroxine replacement. So let us come to the topic, how we have to approach it. I have categorized these patients with the three types to different. Many of my cases has been reported here, and before and after treatment reports also been attached here. So I feel it will be more easy to discuss by case wise rather than simply telling some of the theoretical points, and always such approach will be more striking. This is what I feel. So whatever may be my presentation, so I do like this only. So how we can diagnose? This can be the symptoms of exhibit the patient. A female come to your OPD with complaints of 35, female age 35 years, came to your clinic with complaints of excessive cold intolerance and lethargy. History of, on deep interrogation, she reveals that history of amenorrhea since 2 months. There is no other symptoms, and only the presenting complaints will be excessive cold intolerance and lethargy and this amenorrhea. What could be the diagnosis? Definitely, if a patient come to you, that you have to send the patient, and the TSH exhibited, the analyzed, the result will be somewhere around 5 to 10. So as it is below 10, it can be categorized under the subclinical hypothyroidism or subacute hypothyroidism. So this can be the first group which I have mentioned, that is subclinical hypothyroidism. Definitely, the diagnosis is nothing but subclinical hypothyroidism. The biochemical evidence of thyroid hormone deficiency in patients who have few or no apparent clinical features of thyroidism. They don't have much features of the significant features of the thyroid dysfunctions are simply some of the general features they may present, and the only problem, but the main problem what they feel is the increased TSH levels. So, but the patient will be bothered of that, because they think that if the same situation has been continued, it may worsen the condition, and later it may lead to further complications. This will be their subconscious thought, and there they need to start treatment. As it's in the milder stage, they prefer to take this Ayurvedic medicines. This could be the probable what we say reason for opting Ayurvedic line. So how to approach this case? The main thing is that it's important to confirm that the elevation of TSH is sustained for a period of 3 months. That is the main thing. Please don't start the treatment in the beginning itself. If the first time when you see a thyroid TSH level at means around 6 or 7 or 7.5 or even 9, better not to start the treatment. Just convince the patient. Then that's what that you have to do, and you just ask the patient to wait and watch for a period of 1 more month and repeat the test after 1 month. Again, the same level is they are maintaining the same level. You can repeat it once again in the next month, and still if they are in the same range itself, you may start the treatment. You can just ask the patient in the initial stages for as some of the food regulation or dietary regulation, like some of the exercises, or to avoid the day sleep and to reduce the kapha vardhaka aharas, etc. You can just ask the patient, and then still if the conditions are not under control, we can start the treatment. So as she is almost asymptomatic, we need to only correct the thyroid production pathway. That there is a cycle regarding this thyroid production, especially from that which starts from the raw material, which collects the raw material from the circulation blood, and from that circulation blood, by the help of iodine, copper, and zinc, iron, etc., are being influenced in this stage, and that stimulates the thyroid releasing hormone, and from the thyroid releasing hormone that stimulates the hypothalamus, and this hypothalamus stimulates the anterior pituitary, and from the anterior pituitary the next hormone, that is thyroid stimulating hormone, is being secreted, and this pathway we have to correct. There will be some of the minor corrections among this pathway, and that we have to correct. That is the only one thing. And in my opinion, in most of the cases in this subclinical hypothyroidism, we may not need this RSA drugs in this stage, because always, whatever may be the condition, RSA drugs are a bit dangerous than the herbal drugs. So as far as possible, if we can handle the condition with the simple herbal drugs, better to opt that. And if the situations are not suitable, and if the condition is not favorable, or if the patient is not responding properly, you can go for this RSA drugs along with the herbal drugs. And you can, as for my opinion, here the main role comes for this Annavedi Sindhura or Loha Sindhura or Annavedi Sindhura or Loha Sindhura. Annavedi is nothing but Kasisa Bhasma. That also is an iron compound only. So the common medicines which I use in this stage will be simple Panchakola Churna, then Annavedi Sindhura with either Takra or Nimbu Sarasa. Maybe if the patient exhibit little more Paithika features, in place of Kasisa Bhasma, I prefer to add the Loha Bhasma or Kanda Bhasma, Kanda Sindhura. So this will be my selection of medicines. So probably the Kasisa Bhasma 125 to 250 milligram, either with the Takra or Nimbu Sarasa will be my option, and simple Panchakola Churna. And most probably this line will be sufficient. There will not be any need of any of the Kashayas like Varanadi or Punarnavadi or Drakshadi or whatever it may be. You have to correct the formation of Agni in the subclinical hypothyroidism. That alone will be sufficient to control, and probably within a span of 1 month, 1 month or 2 months, the conditions gets under control, and later you have to taper the dose of this medicine, and within a span of 3 or 4 months, you can stop the medicine, and further you may go for a repeated checkup after 6 months and after 1 year. And still you can see that the condition will be maintained without any complication. So this could be my selection, my choice in this stages. So the next one, after treatment, it was previously it was 9.5, and after treatment it's reduced to 1.89. The second case, a female aged 20 years. A female aged 20 years. came to your OPD with excessive weight gain, and she had weighed around 10 kg. She had got increased, what we say, an amount of 10 kgs in a span of 2 months, along with the severe lethargy and loss of appetite. And her menstrual cycle, the pattern of her menstrual cycle was around, the date was almost correct, that's 25 to 30, but she had a longer duration of bleeding, that is 10 to 15 days, with profuse bleeding and profuse clots. On examination, you can palpate a small non-tender nodules on mainly on either right side or left side of the trachea. Right side, why I mentioned in this case is nothing but it's in the same case. It can be either right side or left side. And the dry and rough skin all over her body, with the skin, the luster of the skin has been lost, and the elasticity of the skin has been lost, and so there are some of the cracks happen all over the skin, especially over the forearm and the left region. Then delayed deep tendon reflex. These will be the simple signs and symptoms presented by the patient. Hope the deep tendon reflex might have been explained by either by Nambisar or our assessor. If they have not explained, I will how to elicit the deep tendon reflex, that I will explain at the end of the session. You can see the nodule actually over the right side of the trachea. You can palpate the nodule at the right side of the trachea. Most probably that will be the non-tender nodule. And when we send for the blood report, the TSH will be around in the range of 20 to 30. And in this case, it was 22.92. So what could be the diagnosis? Or what could be the next step? If this much elevated level has got in the biochemical investigation, definitely next step is nothing but we have to send them for ultrasonography of thyroid gland. And the features suggestive of thyroiditis, along with the two small nodules in the right lobe of thyroid, suggested TFT and FNAC correlation. This was the what we say, the USG report. The diagnosis can be marked hypothyroidism without hormonal replacement. The second one I have mentioned. Here we have to do little more aggressive medication. That is Deepana Bhajana. Definitely you need to continue that Deepana Bhajana. And then along with that, you need to go for Chedana Lekhana line also. And at the same time, you have to supplement some of the iron containing medicine. The medicines I would follow will be either this, it can be Panchakola Churna, or it can be, if the patient is exhibiting some of the Paitika Lakshana or Sama Pitta Lakshana, then better to go for Sudarshana Churna. Or if the patient exhibits Sama Kapha Lakshana, better to go for Shadharana Churna. And if simple, what we say, Agnimandya, especially the Koshtagada Agnimandya, then go for simple Panchakola Churna. This is the differentiation which I follow. If the ama is situated in the Koshta, better the option will be Panchakola Churna. If it is Sama Pitta, the better option will be Sudarshana Churna. And if it is Sama Kapha, the better option will be Panchakola Churna. Along with that, the Chedana Lekhana medicines are also we may have to continue. That is either the best option will be either Varanadi Kashayam or Ardhavilyam Kashayam, as per my opinion. Ardhavilyam Kashayam, either it is known as in the Sahasra Yogam, it is known as Chukujundadi or Ardhavilyam, the same medicine almost known as Ardhavilyam Kashayam also. Along with that, I would add Rasasinduram, Loha Sinduram and Vaja Churnam. What could be the significance of Vaja Churnam here? It's nothing but for the purpose of Lekhana, Chedana and Lekhana. Because Vaja Neeramushnam, Vaja Yavam is the main examples which has been mentioned in Charngadhar Samhita, Deepana Bhajanadimiti, for what we say, the Lekhana medicine, Lekhana group of medicine. Dhadun Malanva Dehasya Vishesha Ullekhayachaga. That's what the definition of Leghana medicines. Leghanam tadyada shaudram neeramushnam vajayavam. Either it can be shaudra, it can be ushna jala, it can be vaja, it can be yava. And along with that, chodhita tankanam with rasnadi churnam along and in the medium of jambira swarasam as local application over the thyroid. And if the swelling is much more prominent, you may go for even Jaluga or Jarna also. Within a span of 2-3 months, around the 22, which was 22, came down to 11, and the treatment has been continued further, and her symptoms are also being reduced. And the next step is we have to, once we got the negative or the positive result in USG, then definitely we have to examine the USG even after 3 months again. So the case will be probably once the USG also might have, the conditions might have been, will be reduced. Once the hormone level has been controlled, the active inflammation also will be reduced. This is what I observe in many of the cases. And the next one is case 3. Male, age 35 years, came to your OP with the main complaints of fierceness of voice, excessive lethargy, severe hair fall since 1 year. He was a previously diagnosed hypothyroid patient and he was on levothyroxine 100 milligram and 100 microgram since 1 year. On examination, palpable non-tender nodules on both sides of the trachea along with the delayed deep tendon reflex. If they have not, once again I tell you, if they have not explained that, I may explain at the end of the section how to elicit the delayed deep tendon reflex. You can see the neck here. Palpable non-tender nodule on both sides of the trachea. The diagnosis can be hypothyroidism with hormone replacement. Again, here little more aggressive medications will be needed, and the medicines may be continued for a longer period. And later, even after the parameters came to the normalcy, still you may have to continue the medicines as a rasayana therapy. Here also, the Deepana Padana, along with the rasaushadhis, you may have to continue. Sedana, Leghana group of medicines has to be continued. Then Sodhana and Rasayana. Most probably in the cases, most of the cases, you may have to continue this Rasayana therapy for a period of 2 to 3 months. The medicines I prefer to use here is nothing but Swayamagni Sindhuram. The medicines which I have been explained till now will be quite familiar to you, and sometimes the capsule that is Swayamagni Sindhuram will be an unfamiliar one, but it is very effective medicines in the case of hypothyroidism. This Swayamagni Sindhuram, the basic reference of this Swayamagni Sindhuram is in Shargadhara Samhita, Bhasma Prakarana, and it is in the name of Swayamagni Rasam. And the same medicine, with a little bit difference in the Bhavana Dravyas, is explained in Sahasra Yoga as Swayam Bhasma. The indication of Swayam Bhasma in Sahasra Yoga is nothing but Amravittam and what we say the Parinama Shulam, etc. And in the Shargadhara Samhita, it is explained in the context of Shayaja Kasa. So the ingredients I will explain later. But this capsule, it's available in capsule, and this Swayamagni Sindhuram is the best medicines as far as my observations in the case of severe marked hyperthyroidism. But at the same time, better not to start in the other 2 cases in the what we say in the subclinical hypothyroidism and the other hypothyroidism without hormone replacement. Better not to start these medicines, because this is not, we cannot say that this medicine is 100% safe because it doesn't undergo what we say for a puta. The method of preparation is nothing but the parada gandhaga will be ground together and formed to kajali, and along with to that kajali loha basma will be added, and this again will be ground together with the kumari swarasa, and that paste is kept under in a tamra pot, in a